Addiction is a serious issue that many people struggle with. When discussing addictions, people often mention the concept of addictive personalities, which can potentially make people more susceptible to suffering from the effects of addiction. So what do you need to know about an addictive personality in order to better understand the nature of addiction? Well, according to Crystal Ray Pohl of Healthline, as well as licensed psychologist and registered nurse Timothy J. Legg, one important thing you should know about addictive personalities is this: they don't actually exist. That's right, you heard that correctly. Okay, so before we elaborate on that, consider subscribing to Bestie and ringing the notification bell, and stay up to date on all of our daily videos and content. In an article written for the website Healthline, Crystal Ray Pohl makes the claim that the concept of an addictive personality is, in fact, a myth. The idea that some people are more predisposed towards having problems with addiction compared to others based on a certain personality trait is just pure fiction. That is because of the simple fact that addiction is a complex issue that affects mental health and can happen to anyone regardless of traits that make up their personality. While some people do indeed appear to be more susceptible to addiction than others, the reasons for this have nothing to do with their personality and instead are rooted in mental health and psychology. To say some people have personalities that lead to addiction is as ridiculous as saying that certain personality traits make you more likely to develop other mental health disorders such as depression and anxiety. To put it simply, that's just not how it works. Nevertheless, the idea of the addictive personality is a popular notion believed by many people to be responsible for developing many people's addictions. Typically, people tend to equate so-called addictive personalities with a variety of traits and behaviors, such as impulsiveness, selfishness, low self-esteem, dishonesty, and a failure to admit responsibility, among others. People who are believed to have addictive personalities are usually characterized as being socially isolated, lacking in personal goals or motivation, and prone to struggling when it comes to impulse control. But can you really identify someone as being at a higher risk of becoming addicted to something based on this collection of traits alone? Well, the short answer is no. According to Ray Pohl, there is no evidence to suggest that people with these personality traits and behavioral patterns are more likely or less likely to develop an addiction at some point in their lives. However, for the sake of clarity, she does mention that certain mental health disorders which affect the personality, such as borderline antisocial personality disorder, may potentially be linked to higher rates of addiction, though the exact nature of the link is currently inconclusive. One thing that is certain is the fact that addiction causes changes to occur in the human brain. According to a research article published in 2017 for the Global Journal of Addiction and Rehabilitation Medicine, it's not always clear or certain whether traits associated with addiction were present before the addiction itself or whether these traits were developed as a result of the addiction. Sort of like chicken or the egg scenario. The myth of the addictive personality can potentially prove to be harmful as well. While at first, the idea that the potential for addiction can be identified by specific red flags in someone's personality seems like a useful concept, this reductive approach to the complicated and nuanced issue surrounding addiction does more harm than help. Not only can it lead people to believe that they are safe from addiction because their personality doesn't match the traits, it can also discourage people with addiction from believing they can recover, as well as falsely suggest that only people with the negative personality traits are prone to addiction. In reality, and we can't stress this enough, addiction can happen to anyone. So if the idea that the addictive personality is a myth, what are some actual factors that can potentially contribute to someone developing an addiction? According to Ray Pohl and other experts, there are a number of factors and triggers that can potentially increase an individual's risk of forming an addiction. In some cases, the contributors for addiction can begin as early as during the childhood years. Neglectful parents or a generally uninvolved upbringing can have the potential to increase someone's risk for getting involved with addictive substances. The same goes for children to experience abuse or other forms of childhood trauma. Other environmental factors, such as seeing other people misuse addictive substances as a child, can also make a person more likely to dabble in those same substances. And early exposure to these substances in school or within a person's neighborhood can also make a significant impact on addiction risk. Other factors contributing to addiction are more nature than nurture. According to the National Institute of Drug Abuse, a person's risk level when it comes to addiction could be anywhere between 40 to 60% linked to that person's genes. A person's age can also be a major factor in their likeliness towards addiction, with teenagers being more likely to be at risk for addictive substances than adults. Finally, other mental health-related issues such as depression, anxiety, OCD, bipolar, and other personality disorders can all play a part in a person's development of an addiction. In these cases, having both a mental health condition and a substance use disorder is what's known as dual diagnosis. 3.3% of adults in the United States were identified as struggling with a dual diagnosis, according to the 2014 National Survey of Drug Use and Health. If you know someone who might be suffering from an addiction, there are a few ways in which you can help. For starters, get more information about the addictive substance in question and its potential for misuse. This will give you a better idea of what the other person is going through, as well as what types of health and treatment might be available to them. You should also feel encouraged to show supportive behavior and avoid coming across as judgmental, as contributing to the already existing stigmas surrounding addiction will only cause the person you're trying to help to experience further shame and hesitation to ask for help. You should also try to stay involved with the other person's recovery and treatment process. Employ active listening techniques and offer to spend time with a person recovering in order to show support and solidarity when they're experiencing a rough patch in their treatment. If someone doesn't want to or outright refuses your help, try not to take it personally. At that moment, there's probably little you can do to change their mind. As always, seeking out mental health professionals may also be beneficial during these periods. Addiction can be scary, especially when we suspect ourselves or a loved one may have an increased risk of developing an addiction. But by continuing to educate ourselves on the facts as well as the fictions surrounding addiction, we can better understand, prepare, and take precautions against the things that we contribute towards addiction, as well as disproving the stigmas around the things that don't. Did you like this video? Is there anything that you'd like to add to this discussion? If so, feel free to let us know in the comment section below and help us keep this conversation going. As always, we encourage you to give this video a like and share it around with anyone you think might find it interesting or useful. Thanks for watching. Enjoyed this video? Hit the like button and share with your friends. Also, subscribe to our channel for more videos like this. Thanks for watching.